As Governor Herbert said, I am a frontline physician. I've practiced pulmonary and critical care medicine at Utah Valley Hospital since 1985, and I do love my job. I would wish every one of you could come and see the great things that we do. Governor Herbert talked about the team of people that we have. He mentioned doctors and nurses, and the team is more extensive. We have amazing aides that help us, our patient care technicians, pharmacists, even the housekeepers and the hospital administrators. This has been a terribly stressful time for hospital administrators. Governor Herbert mentioned that I'm from Utah County. I grew up actually in the same area, went to the same schools as his wife and their family, and have just a great love for Utah County. That's my home, and I'm deeply saddened at what's happening there because of the controversies around this disease. It's become contentious, and it doesn't need to be contentious. There are some things that we do know. As Governor Herbert said, you know, we've had mixed messages about the wearing of masks. And so I think it has been somewhat confusing, but there certainly is emerging science that tells us that masks help prevent disease. And I just want to make 2 points today. One point is masks make a difference. And let me just maybe share with you a little bit of some of the evidence behind that. The evidence includes things like when we started having this COVID-19 infect people in Utah, one of the hot spots was Summit County. They had far, far more people per capita than most of the other places in the state. There were people coming in and out of the county because of the skiing and so on, and so that was one of the places where it started. But they had a mask mandate. A lot of people didn't like a mask mandate. They didn't like to be told what to do. But it set the expectation. The expectation was we wear masks, and when we do that, it helps to prevent the spread of COVID-19. And very soon, the Summit County kind of dropped off of being a hot spot, a trouble area. Now we have a hot spot trouble area in Utah County, my home. And we need to do the same thing. We need to wear these masks to help us prevent that. I would suggest, as Governor Herbert said, that if we want to win, then we can think of the 3 things that will help us to win. One of them is wear the mask. The second thing is wash your hands frequently. And the third thing is watch your distance. Stay socially distanced. If we do those 3 things, then that will help us a lot. There are a couple of other little, I think, there are kind of case studies that help us to know how important wearing a mask will be. One of them was a documented case in Missouri where there were 2 hairdressers who both were infected with COVID-19. They didn't know it at the time, but they were still cutting hair. They wore masks, and they also required their patrons to wear masks. They had, I think if I remember correctly, around 140 patrons between the 2 of them come in and out of their salon. Not a single person developed COVID-19. Even though 2 people had the COVID-19, that was very, very effective in preventing the spread of COVID from the people that were infected to their patrons. On the other hand, there was a situation where there was a woman who was on an airplane. She was sick. She didn't know she had COVID-19, but she had symptoms. She was coughing. She was on a plane, and at the end of that, the people around her, and I think they traced 27 different people from this one super spreader. She wasn't wearing a mask. The other people weren't wearing a mask, and because of that, 27 people got sick that really wouldn't have needed to get sick if they had been wearing masks. And there's another situation kind of similar, but the opposite. It was a man who was on an airplane. He was sick, didn't know he had COVID. He was wearing a mask. The people on the plane around him were not necessarily wearing masks, but nobody on the plane got COVID-19 from him because he had the courtesy, because he had the decency wear a mask and prevent that. So those are just a few little anecdotal kinds of evidence, but there's the basic science is sound, and so I would plead with you to wear a mask, and especially students in Utah County. When you're going to be with your friends, please just wear a mask. Set that as an expectation. Hey, around here we're gonna mask up. That's what we do. That's the way that we can do that, so that we can stay open, so that we can stay with our friends, so that we can go to businesses, so that we can do the things that we need to do, so that we can go to school. All of those things can stay open if we'll wear a mask. My concern is that if we don't wear masks and we continue to have this surge, then we'll have to shut down our businesses, our schools. And I'm also really concerned about what I'm going to see in the ICU where I practice, that I'll see a surge of patients that will overwhelm us. We have done very, very well by any standard in terms of our mortality and our survival from COVID-19 in our Utah hospitals. We have had the resources. We have planning. We have amazing teams of people, but we can be overwhelmed. So the first point is, please wear a mask. The second point I'd like to make is, well, does it make a difference? If only less than 1% of people in Utah die, why don't we just have rave parties and all get together, and who gets sick, and most people won't die, and then we get over it. And my plea is, please don't do that. The people who get sick with COVID are very, very sick, and each one that I see, it's heartbreaking. And I wish you could see what it's like to have somebody who's got COVID and is not sure that they're going to survive. They're in the ICU, all alone, no visitors nowadays, writing goodbye notes to their children. That's not something that's easy to watch. I wish you could see the fear in families' eyes when they see somebody transferred to the intensive care unit, afraid that they're going to die. I wish you could hear the friends of people saying, I pray morning, noon, and night, and in between, for my friend who's in the ICU. Well, that particular friend right now is out of the ICU. Should we cheer? He's improving. He's off the ventilator now, but we're not time to celebrate quite yet. COVID can be very, very cruel. Sometimes just when you think they're better, their lungs are starting to improve, then their heart stops from myocarditis, and they're gone. This particular gentleman that I'm thinking of, he's off the ventilator, he's out of the intensive care unit, but he can't walk from here to a bathroom 10 feet away without his oxygen saturations plummeting. There's still a horrible fibrosis in his lungs that's not getting better. We have some people that we call long haulers. The long haulers are people who have been affected by the COVID-19, and it just keeps hanging on, and it doesn't go away, and they don't feel very good. They cough, they're short of breath, they have fatigue, sometimes they have mental fogginess. This is a miserable, persistent, ugly disease, and whatever we can do to prevent it, we ought to do. Utahns have a history of being generous, of wanting to get involved, of wanting to serve, of stepping up when there's a problem, of wanting to, we say, what can I do? How can I help? Well, there are three things we can do that we can all do. There are small things, there are simple things. Some people may think they're foolish things, but they're not foolish things. They're small and simple things that will make a difference, that are the best science we have, and it's not perfect science, but the best science we have says wear a mask, wash your hands, watch your distance. And if we do those things, then we can help to bring this thing to a close, and we can win this thing. Governor Herbert said, an ounce of prevention is better than a pound of cure. We're working on the cure. We're lots better than we were 6 months ago. We've learned some things that work. We've learned some things that don't work. And so we are better. But it's still way, way better to be able to prevent COVID than to try and treat COVID. So I just leave those things with you, and I hope that you'll be able to tell your friends and create the expectation in our home when we go out, in my apartment with my friends, we wear masks. That's just what we do. We do that because we are socially responsible, because we're considerate, not because we're living in fear, but it's because we want to have our lives as normal as possible. And this is a small, simple thing. So I just plead with you to be not weary in well-doing, do those little things that we know make a difference.